Well, welcome everybody, and thank you very much for coming today. We are delighted that you're here. Briefly introduce myself. My name is David Schude. I'm Medical Director of the Quality Corporation and one of the leads on the Oregon patient experience work. And we're absolutely delighted that you can be here really for this kickoff meeting where we will begin to dive into the questions of what is patient experience, how should we use it, and what can we do to move our community forward in terms of improving the experience of patient care. So again, we're delighted to have you here, and we've got an excellent program for you this morning. We're a little crowded in the room, which is great. So just for logistics, anybody who's got an empty seat next to them, can you raise your hand? So we've got a few scattered around. Okay, so we'll have a few more people coming in. If you see somebody lost, motion them over and give them a place to be. So thank you very much. I have a few brief opening comments about patient experience and what we're going to really do here today. And I would open with an often used but I think valuable Chinese proverb or curse, depending on who you listen to, and it is that may you live in interesting times. Well, I certainly think we live in interesting times, and especially for those of us working in healthcare. Healthcare is changing. It's changing very rapidly. It should, and in fact, we must, for reasons that I think we all know all too well. I think the first message that we probably share because we're here is we need to lead that change. And if we miss that opportunity to take leadership, I'm confident things will go amok. And even if we do our best, things might go amok, but we must be there to lead and to do our best. And it's really a duty to our patients for their health and safety, and our leadership is really a duty to each other to sort of preserve what is sacred and good about the work that we already do. But as we look at the role of leading change and where we want to go, it's daunting for many reasons, not the least of which is where's the roadmap for where we want to go. And I think as I've watched transformation take shape over the last decade, what's really emerged is the IHI framework of the triple aim. And so today we put patient experience underneath that umbrella of the triple aim, which you see here. And so I'm sure all of you know it, but I just will briefly revisit it because I think it's an interesting context for what we're going to talk about today. The triple aim, of course, is improved population health, decreased per capita cost, and improved patient experience of care. At least that's how it was initially articulated by IHI, the Institute for Healthcare Improvement. An interesting observation is it's transformed over time a little bit, and different organizations shape it to meet their needs, which is fine. But I do think it provides a great framework for what we do. Well, and in my work in process improvement for the last decade, it's been very interesting. For the last 2 decades, I think there's been tons of activity around improving cost. Managed care of the 80s and 90s, pre-authorization. I need to get permission to get an MRI scan on my patients. Those are all efforts at cost containment. Benefit designs that employers are doing that put more of the cost on patients. There's a ton of activity around improving costs. For better, for worse, there's a lot going on there. What is population health? I think we share some understanding and definitions around what that is. And again, I would say there's a lot of activity at multiple levels on improving population health. Public health is working on this, providers are working on this, health plans are active, and again, employers are very active, and the state. Lots of activity on population health. So we get to the third leg of the stool of the triple aim, and it's patient experience. And what's going on in terms of patient experience? Well, I think for most providers and practitioners in this state and for most patients, we don't even have maybe a shared definition. We're just beginning to share measures, and I think there's a real positive activity going on to help us understand what is optimal patient experience and how do we create that for our patients. And so it's into that need, into that vacuum, if you will, that we've created this program for you today. And our hope is to begin to show you or help you understand a little bit more what is a legitimate and valid way to measure patient experience, to begin to ask questions, how can we begin to understand what we're doing and how can we do it, and then to really help bring you forward to a place of action, whether it's moving into the world of actually getting data and looking at it, or if you're one of those pioneer clinics who are already collecting data and looking at it, what are the next steps? So that's really what I want to do this morning. The first acknowledgement I want to make is that there is a group of clinics who have actually stepped forward, we're calling them our pioneer clinics, which I won't name, to actually field the PCMH CG CAPS Medical Home Survey, and they've just gotten their data. And we just had a little bit of a collaborative session this morning before you all came to begin to look at that. So there is momentum in the state. You'll hear in a later session what's happening nationally in terms of what's going on in patient experience. We have a section about what's going on in the state and how this fits with where you may be going. And so there's a lot I think that will help to answer these questions for you today. We're going to start by actually hearing from patients. Surprising that we would pause to do that. But we want to hear from patients what they think about experience, and more importantly, what they think we should be doing in this domain. So that's how we're going to start. We're going to hear stories from early adopter clinics about what they're doing with their data, and I think there will be great lessons from there. Then after a short break, we'll have 2 breakout sessions. One is led by Janice Gray, making sense of CG CAPS data. If you have it, it's a great way to begin to make sense out of it. If you're thinking about getting it, it'll let you have some ideas what you can do with it. Parallel to that is a session by Dale Schaller and Janine Smith looking at both the national and the state really trends on what's going on with this data. So if you're thinking about getting in the game, if you're thinking about where's the business case for your clinic, if you're thinking about does the world really want that, that's a great session for you to begin to get a feel of where the world's going so you can make some well-informed decisions for your clinic and for your patients. And then we're going to come back here and wrap up with our keynote with Larry Morrissey, who's actually a very accomplished physician and by no coincidence a pediatrician, because for some reason the pediatricians seem to be ahead of everybody else in this, about what they have done in their group with patient experience data and what they've done to make it better. So that's really a quick overview of our session today. We're very excited about it. We're mostly excited to have all of you here.